Hello and welcome back to GP Video Podcast by Nadia. So today I'm going to talk about obesity and endometrial cancer. Endometrial cancer is also known as uterine cancer. Obesity is one of the biggest risk factors for uterine cancer. Reason is that uterine cancer is usually caused by unopposed estrogen. As we know that the women have both estrogen and progesterone in their body. Even the combined oral contraceptive pills that women take, that also has both estrogen and progesterone. The reason progesterone is combined with estrogen is because estrogen causes the hyperplasia or growth of the endometrial surface or the endometrial lining of uterus, and progesterone opposes it. So progesterone just sheds the lining in the cycle. That's why progesterone is always needed as part of the combined oral contraceptive pill and also needed as part of HRT or hormone replacement therapy if ladies still have uterus in. But because obesity causes, what is obesity? Obesity is like more and more adipose tissue or fat tissue, and estrogen is made up in adipose tissue or fat tissue as well. So the more obese a woman is, the more unopposed estrogen she has, and that causes endometrial cancer, or that actually imposes more risk for developing endometrial cancer. So I would like to read out for you a few articles, like few lines from few articles to make you get this point. It says, one of them is from Journal of Clinical Oncology, an American Society of Clinical Oncology journal. It says that in sharp contrast to many other cancer types, the incidence and mortality of endometrial cancer continue to grow. This unfortunate trend is in no small part a result of the worldwide obesity epidemic. More than half of endometrial cancers are currently attributable to obesity, which is recognized as an independent risk factor for this disease. So among women, obesity is more strongly associated with the development of endometrial cancer than any other cancer type. In fact, approximately 57% of endometrial cancers in the United States are thought to be attributable to being overweight and obese. So then if we come on to the other one, so obesity has been linked to several common cancers, including breast, colorectal, esophageal, kidney, gallbladder, uterine, pancreatic, and liver cancer. Obesity also increases the risk of dying from cancer and may influence the treatment choices. So not only it is the risk factor for so many cancers, including uterus cancer, uterine cancer, actually it also makes prognosis worse. So once you are diagnosed with the cancer, and if you are obese, the prognosis is worse than a patient who is not obese. About 4 to 8% of all cancers are attributed to obesity. The underlying mechanism of obesity causing cancer is complex and is incompletely understood. But in case of uterine cancer or endometrial cancer, we know the mechanism, because obesity means more adipose tissue. More adipose tissue means more unopposed estrogen, and that actually causes the multiplication or growth of the endometrial lining, and that imposes the risk of growing endometrial cancer. So this was all about the obesity and uterine cancer. Again, obesity is associated with an increased risk of uterine cancer. Estrogen levels increase in obese individuals, which can lead to endometrial cancer. Overweight women are twice as likely to develop endometrial cancer, and obese women are more than 3 times as likely. So there is overweight. BMI of 25 to 30 is overweight, and then after BMI over 30 is obese. So overweight women between the BMI of 25 and 30 are twice as likely to develop endometrial cancer, while obese women, which is an BMI of 30 and over, are 3 times more likely. And as I said, about 57% of endometrial cancer in the Western world are attributed to being overweight and obese. So again, as I said, obesity is pandemic, and we really need to address this issue. not only with lifestyle changes, with exercise, with diet changes, but also, if possible, with the medications as well.